every year, there are close to 500,000 people that are hospitalized with influenza. In 2018, 2019, there were almost 35,000 people who died of influenza. This is not a regular cold, and so it's important that we understand that this illness is preventable. So what we do is we screen for individuals who present to our emergency department to see if they've been vaccinated for influenza. And if they have not, we offer them an influenza vaccine. This year, we've actually expanded to the other institutions, and at Harborview, between October 1st and now, we've already vaccinated over 500 individuals, and almost that many at the UW-MC Montlake campus as well. We see a lot of vulnerable individuals in our emergency department. It's a place where people often seek care who don't have access to care elsewhere. And so it's really important that we provide services for those individuals who may not be accessing the healthcare system in other locations. Early indications suggested that co-infection with influenza and COVID wasn't necessarily as common, but as we've learned more, we see that that's not necessarily the case. And we really worry that people who are at risk for poor outcomes, so those individuals who may have COPD or asthma, if they get influenza and COVID, that really sets up a deadly combination. And so we need to do what we can on the prevention side to keep people from coming into our emergency department when they're sick. The emergency department is not the place to go for a flu shot. But if you need to go to the emergency department, we need to understand that that's an important contact with the healthcare system, and we can provide those services while we have people in the ED. So it should never be used for regular routine preventative services, but we need to understand that sometimes we can capture people who aren't receiving them. I think that the more that this becomes normal within emergency department care, the more we're able to provide similar types of services. Again, understanding the balances of providing emergency care for those who need emergent, timely service, and those who may not have access to services.